think we have a bunch of folks with us, so we can go ahead and get started. Thank you all for joining us today for this panel. Just to run through some quick kind of logistical things with using Zoom. So if everyone could keep themselves on mute while our presenters are speaking, that would be great. There will be some Q&A time throughout this panel today. In order to ask a question, we just ask that you use the raised hand feature, which you can find when you hover your mouse over the screen. You should see participants icon at the bottom. Click that, and a box should pop up on your right, and there will be a little hand signal that you can click that says raise hand, and we'll be able to see that and then call on you to ask your question, at which time you can unmute yourself, of course. If you are encountering any technical issues throughout this, feel free to send a chat directly to me and I can help problem solve. If you also feel more comfortable to submit a question via chat, feel free to do that as well. I will be able to get those and then can relay your question to our speakers. And on that note, I will pass it off to you, Monette.
Great, thanks so much, Lizzie. And I should really begin by welcoming you all to this panel on health and human rights in the COVID response, and to thank Lizzie as well as Joanne Chetta and Terry McGovern. This event has been co-organized by two certificates within the Mailman School, the Certificate on Health and Human Rights and the Certificate on Public Health and Humanitarian Action. I am here representing both groups of students and faculty in putting this panel together. So thank you to my colleagues for helping bring this together. And I think for all of us who've been experiencing and watching the COVID pandemic and the response roll out, we know that human rights are deeply implicated in different aspects of the response, from issues around who has access to care and testing, through to issues of discrimination, stigma, xenophobia, constraints on freedom of movement, and of course access to information as a theme that runs through a lot of this. And so today we have three incredibly distinguished speakers to help us think through different aspects of the pandemic and the human rights implications of both the pandemic and the response to it. Our first speaker is Ken Roth. Ken is the Executive Director of Human Rights Watch, one of the world's leading international human rights organizations that is present in over 90 countries. Prior to joining Human Rights Watch, Ken served as a federal prosecutor in New York and on the Iran-Contra investigation. He's a graduate of Yale Law School and Brown, and has written extensively on a wide range of human rights issues, particularly focused on issues relating to international justice and counterterrorism and the work of the UN. So welcome, Ken, and we hope that Ken will be able to provide us with an overview of some of the key human rights concerns that are really emerging in the context of the pandemic and the response. Our second speaker today is our own Dr. Goleen Samari. Goleen is an assistant professor in the Department of Population and Family Health, and she is a public health researcher coming at these issues from the perspective of demography, and she focuses on the rights of marginalized communities and health disparities relating to migration, gender, and discrimination, both domestically and globally. And we hope that her presentation will really help tease out how the pandemic and the response are impacting on immigrant populations generally around the world. And then finally, we have with us Bruce Shapiro. Bruce is the executive director of the Dart Center for Journalism and Trauma, which is a project of the Columbia University Graduate School of Journalism. And the Dart Center works to encourage innovative reporting on violence, conflict, and tragedy worldwide. He is an award-winning reporter on human rights, criminal justice, and politics, a contributing editor to The Nation, and a U.S. correspondent for Late Night Live, live on the Australian Broadcasting Corporation's Radio National. He's also senior advisor for academic affairs at Columbia, where he teaches journalism ethics. And as you would expect, we've asked Bruce to really help us draw out some of the tensions and challenges around ethical media reporting in a pandemic context. So each of our speakers will speak for around 10 minutes or so, and then we will open it up for a discussion as best we can via Zoom. So without further ado, I think I'm going to hand over to our first speaker today, which is Ken.
All right. Well, thank you, Monette. It's a pleasure to be here. I'm glad we were able to proceed virtually, and we didn't have to miss this just because of the virus. So, I wish I could see you all. I at least could see your names as I scroll through the list. That's a beginning. But hi. I wanted to sort of address two dimensions of the problem. One is, how is the governmental response to COVID-19 respecting or not respecting the rights of people in terms of just the delivery of basic healthcare. And second, I want to look at how have governments misused this crisis to take steps that are troublesome from a human rights perspective. And I'll just kind of run through each of those fairly briefly, and we'll have plenty of time for conversation, I'm sure. First, in terms of the response to COVID, I think that, what I'll say here is in many ways pretty obvious, but governments are responding in a way that doesn't necessarily take into account the right to health, which may seem odd since the whole thing is about providing healthcare. But when I consider the right to health, what I really mean is, are the least fortunate segments of society, the vulnerable, the left behind, the marginalized, are they able to access healthcare? And if you looked, simply at Trump's response as one example, it did a terrible job in this respect. It gave a lot of money to hospitals, but didn't really change the system in which people have to pay, which of course is limited by the inconsistent, patchy health insurance system that the United States has. He is giving income to people who are sort of, more formally on the books, but not to people who are undocumented immigrants. And I could go on, there are many examples of this, but it is, there's a certain callousness that you would almost expect from the Trump administration. But there's also a counterproductiveness because, the virus doesn't really care who it infects. And if it can find a vulnerable segment of the population and thrive there, it's just a matter of time before it then spreads out more broadly. And you can say this about, the overpacked prisons, which are clearly incubators for the virus, and where, where the United States is going to, in a sense, pay a price for its over-incarceration policies. There's been very modest movement to let some people out, but extraordinarily modest. Why do we have an immigration detention system at this stage, given the vulnerability of people in custody? They're not good answers to this. But it does, kind of bump up against elements of the far right agenda, and that agenda is not being sacrificed in broad ways. And this is not just a U.S. issue. If you look around the world, Human Rights Watch put something out this morning about how in northeastern Syria, the Turks are restricting access to water. And, we all talk about washing your hands and so forth. It's hard to do that when you don't have clean water. And there are, large refugee populations, displaced populations, say the Rohingya in Bangladesh, or the 3 million civilians crowded into northern Idlib. These are incredibly ripe groups of people for the virus to spread. And, when you have the Bangladesh government doing everything it can so that the Rohingya don't get too comfortable in Bangladesh, including, limiting internet access, restricting the ability to build kind of institutions like healthcare institutions, it's just, it's a recipe for disaster. You can obviously say the same thing about Idlib, where, the Russian and Syrian bombers have been deliberately attacking the healthcare system. And now, there's this odd boomerang effect that may emerge where, suddenly Syria has got to worry about germs that don't respect the front line. And if they flourish in Idlib, they're going to then, move elsewhere within the country or across international borders. So there's that set of issues. Is the global response really looking after the marginalized, who are in many ways the most likely to catch the bug, and then will provide an incubation which will enable the bug to flourish. The second thing that I would mention is just that we have seen a number of governments respond to what is genuinely a severe threat with self-interest rather than the public interest foremost in mind. And we saw this, right at the outset. I mean, if you look at China, the Chinese government's response to the doctors in Wuhan who tried to alert us in December that something was going on. They called it a SARS-like coronavirus. They didn't have a name for it yet. But they were aware that there was this pattern of pneumonia, seemed to be linked to the wet market. And they tried to sound the alarm, but bad news wasn't welcomed under the Xi Jinping regime. And so for 3 weeks, their message was suppressed. They were actually chastised rather than having their message heeded and in a real effort mounted to address the virus. Some of you may have seen the University of Southampton study suggesting that if those 3 weeks had been used to really fight the virus rather than to contain the bad news, we would have expected that there would have been 95% fewer cases by the end of that 3 weeks. Instead, what happened was that there were millions of people who moved through Wuhan, millions of people who left Wuhan and traveled throughout China and the world, and you have a pandemic on your hands. And indeed, the Chinese government has done everything it can to continue that kind of censorship since then, since it's desperate that people not talk about this. And so journalists who have traveled to Wuhan have been arrested. The correspondents for the New York Times, Washington Post, Wall Street Journal are being expelled. There's this desperate effort to kind of focus on China's claims that it has tamed the virus rather than its early actions that helped the virus explode. And the lesson from that obviously is that in order to have an effective public health strategy, you need access and dissemination of accurate information promptly. And it's not just China that didn't do that. We're now seeing, many governments around the world that are trying to suppress the bad news. In Egypt, President Sisi just didn't want to know about it because he was afraid that it would jeopardize Egypt's tourism industry. In Turkey today, Erdogan is actually in the process of prosecuting a member of parliament who's a doctor who was talking about how there is coronavirus in the Turkish prisons, which should be no surprise, but bad news is not news that Erdogan wants to hear. In Thailand, the junta, which has now taken off its uniform and put on civilian clothes, has told journalists you're only allowed to report on what official press conferences report. You cannot speak to medical personnel in the field. And it's as if, the public health strategy is ignorance is bliss. But, the virus doesn't respect that logic, needless to say. And this, deliberate blindness is a public health disaster. But it's what we're seeing from many autocrats. I mean, my favorite was that, Turkmenistan has now outlawed mention of the virus. They're just going to wish it away. And so this is, these things sound crazy, but, various leaders, for whatever reason, have seen their success equated with no bad news, with the coronavirus not being a problem in our country. It's like, Brazil's President Bolsonaro saying, Brazilians don't get sick. We can survive anything, as he, very overtly flouts the rules. You saw the same thing in Mexico where, Andres Lopez Obrador, Manuel Obrador was saying that, there's no need to worry about this. He's running around ostentatiously hugging his supporters and shaking hands. And it was only like 2 days ago that he finally changed his tune. So we see this, bad information, suppressed information coming from a lot of different governments. The two other problems that I see coming from autocratic governments are, first of all, a real power grab. And you know, Hungary's Prime Minister Viktor Orban is the best illustration of this, where he got his 2/3 majority in the parliament not only to declare an emergency, but to give him the power by decree forever, you know, until the parliament reverses that. And ruling by decree includes not having elections, not having referendums. So in a sense, he's created a dictatorship in the middle of Europe, in a state that, you know, ostensibly is a member of the European Union and abides by European Union democracy and rule of law standards. So this is, you know, a big challenge to the European Union. They so far have not done very well, but, you know, they're aware of this challenge. But that, I think, was the most brazen attempt to use the coronavirus as an excuse to seize power. But I think we're going to see these kinds of emergency direct declarations around the world. And it's, you know, certainly you get many governments that are breathing a sigh of relief that the coronavirus has enabled them to shut down protests that have been menacing their ability to stay in power. And whether it's, you know, the pro-democracy protesters in Algeria or Hong Kong, Lebanon, Iraq, Russia, you know, these, India, for the time being, it's all over. And it's an open question, you know, will governments admit that this was an emergency that has ended at some point, or will they have a permanent emergency and allow these restrictions to stay in place? The final thing I'll mention is just surveillance. And, you know, I think there are many analogies in kind of what I've described so far, and certainly in the surveillance realm, to the war on terrorism. You know, if you think back to 9/11, people were fearful. They wanted the government to protect them. And there was this tendency to say, you know, do what it takes, you know, whatever it takes, just, you know, make me safe. And I don't know that it's quite the same level of panic this time around, but there are many similarities. You know, people are afraid. It's a scary virus. And governments are acting ostensibly to protect people, but with, you know, not necessarily with the people's interests in mind. And, you know, what we saw after 9/11 is that when governments seize powers, it's very difficult to get them back. And one place where we saw that really just explode was in the realm of surveillance. You know, after 9/11, the government, really the US government, adopted this massive, you know, vacuuming up of our metadata. They were listening in or reading many of our phone calls or emails. And while there was, you know, modest efforts to bring this back, much of that continues to this day. You know, similarly, you know, Guantanamo is still in place. The Bush CIA torturers were never prosecuted. You know, the targeted killing by drone continues to this day. And I fear we're going to see something similar, particularly in the realm of surveillance with respect to the coronavirus. The place that probably is, well, the two places that have developed this the most, and one is China, where already they had a very intrusive surveillance state in Xinjiang, which they were using to identify, you know, which million among the Uyghur and other Turkic Muslims should be detained for forced re-education. But they are now extending that out across the country. You know, people are being required to sign up for these apps that make it easy for the government to monitor their location. South Korea did something very similar and would actually broadcast, you know, so-and-so, you know, may have been exposed to the coronavirus when they took this bus or when they visited that site. And, you know, that sounds like, you know, maybe an appropriate thing to do to safeguard people. But if you think about it, you know, it's revealing intimate details about people's lives. And we have a very underdeveloped body of law with respect to location data. You know, our phone, you know, this is my tracking device, you know, and when I walk around with this, it enables people to track me. And what we need to do is to, you know, work out standards that enable us to maintain some degree of anonymity in public. You know, theoretically, the police could follow us, you know, but that's expensive, time consuming, and it hardly ever happens. But if you track people via their phones, it's easy and it can be done en masse. And I'm afraid that unless there's a very rapid effort to impose privacy restrictions on that kind of tracking, we are going to lose this battle. and suddenly our ability to be anonymous, to enjoy a degree of privacy in public is going to be vitiated in a permanent way. So I will stop there. But those are, some of the human rights issues that I see posed by this pandemic.
Thanks so much, Ken. You've given us a great start and a lot to think about and digest. So I think, Goleen, you're slated to go next.
Great. I'm going to try to share some slides. Let's see if I can manage. Can we see that? Perfect. Okay, so I'm going to dive a little bit deeper into the migration aspects of the human rights dimensions of the pandemic. So the right to health, as we've sort of gone over, basically includes the prevention, treatment, and control of endemic, occupational, and other diseases. And in the context of a pandemic or epidemic, it really does require states to ensure that preventative care goods and services are accessible to all persons. It's the duty of the state to promote and protect all human rights and fundamental freedoms, regardless of political, economic, and cultural systems. So it's important to mention that non-discrimination is a cross-cutting principle in international human rights law, and non-discrimination in this case means equitable access to care and services. So it's easy to think about disparities and differences between populations based on sort of where they're from or where they're going and things like that. But coronavirus and COVID-19 doesn't really differentiate based on sort of what passport you hold or where you came from. So the health of every person is linked to the health of the most marginalized members of the community. And preventing the spread of the virus requires outreach to all and ensuring equitable access to treatment. So this means that you have to really overcome barriers for those who are marginalized and face difficulties in accessing public information and services for a variety of reasons. And some of these barriers are really entrenched in state structures around the world. Health strategies should address not just the medical dimensions, but also the human rights and gender-specific consequences of measures taken as part of the health response. Treatment essentially needs to be available to everyone, without discrimination. And this means that ensuring no one is denied treatment because they lack the ability to pay for it or don't have a status that allows them to have treatment, or because stigma prevents them from it. So briefly, before specifically getting into migrants and refugees around the world, I want to just highlight the gender dimension of this. So health for all includes women and girls, and restrictive public health measures like quarantines are increasing exposure to gender-based violence. So a human rights approach would really ensure that support services and safe shelters are available for victims of gender-based violence and family-based violence. So these need to continue to be a priority. Similarly, sexual and reproductive health services should be seen as a life-saving priority because these disproportionately women and girls are impacted by restrictions in sexual and reproductive health services. So migrants and refugees, regardless of their formal status, must be a part of national systems and plans for tackling the virus. And we have seen more often than not that this is not the case. Many women, men, and children find themselves in places where health services are overstretched and completely inaccessible. But as part of non-discrimination and not facing discrimination as a sort of human right, it's important to highlight the racism and stigmatization that have increased, particularly towards Asian populations around the world and Asian American populations in the US. Also, the added risk of exposure is clearly among immigrants, incarcerated people, people over 60 years old, people with disabilities, and others with special needs. Quarantine policies and practices are really happening around the world with risk to human and civil rights. And the coronavirus is used to justify more restrictive migration policies and practices often. So brief history of sort of racism and pandemics. Public health events have always been racialized. It's generally found that pandemics that originate in areas populated mostly by people of color get more scrutiny. So SARS and Ebola were really racialized versus H1N1 and mad cow, which originated in the West or the global North. those were less scrutinized and racialized as public health events. I think for the US, it's also important to point out that anti-Chinese sentiment dates back to the 1800s. So you had the Page Act of 1875, which restricted East Asian women from immigrating to the US. You also had the Chinese Exclusion Act of 1882, which banned most Chinese people from immigrating to the US. And these were based on the notion that Chinese people inherently brought some sort of illness or disease. And so the racism and stigmatization of Asian Americans that's linked to this pandemic has historic roots and is being observed in countries around the world, not just in the United States. So there's lots of headlines about this lately. So the rise of coronavirus hate crimes, Trump's racist comments. The Asian Pacific Policy and Planning Council has started collecting data on hate crimes. So if you see something or experience something, you need to report it there. And there's been calls by Congresswomen for action against anti-Asian sentiment surrounding COVID-19. So now a little bit deeper about the forcibly displaced populations of the world. So there's 70 million forcibly displaced people, including refugees, asylum seekers, internally displaced populations, and other forced migrants. This pandemic really exacerbates and is exacerbated by the conditions in which many of these populations live. These conditions are related to things like population density, access to basic services, limited reliable information, disruptions to the humanitarian supply chain, and changes in financing for humanitarian crises. So a lot of the basic services are highly dependent on financial contributions, which are largely perceived as like they're going to change in the near future because of pandemic response. So we've touched on a little bit, Ken touched on a little bit, like what does COVID-19 look like in a situation with that lacks water or sanitation? I was in a discussion with an NGO recently that was trying to figure out how do we teach hand washing in a camp setting that really lacks water and soap? Do we implement soap making programs? What do we do? And I think these things haven't been thought of for a lot of these remote populations, which and that's the first line of defense that we have against coronavirus. So if these populations are affected, it's going to be really devastating. It's important to recognize that migrant populations take all different forms, right? So there's migrant workers that have been affected in Thailand and India. There's refugee groups at the border that are reliant on humanitarian aid. And so all of these things have been disrupted by the pandemic. So I'm going to give a really brief glimpse at some populations around the world. So, and this information was largely pulled by a report that I believe came out yesterday from Refugees International, and they tried to give a snapshot of different groups around the world and how they were affected. Afghan refugees in Iran, there's about 3 million, and the situation is pretty dire. They have no access to basic services like healthcare, even before the pandemic began. Most had difficulty accessing any sort of basic services, and tens of thousands are returning to Afghanistan. There's about 120 COVID cases in Afghanistan currently, but most of those are believed to have come from Iran with return migration. The Rohingya refugees, which were mentioned in Bangladesh. So health workers are receiving training to improve the disease outbreak, but only essential services are allowed in the camp. So there's potential for food insecurity. And I think that that's an important thing to think about, is that these populations are reliant on services. And so disruptions to these services make them not have access to basic needs like food or essential health care, even before we consider what we need to do for the pandemic response. In Somalia, there's an IDP population of 2.6 million, and there's about 16,000 refugees. There are no kits available to test for COVID-19. The samples are currently sent to South Africa. And the government in Somalia has halted international flights, closed schools, and prohibited large public gatherings, but these measures are not well enforced. In the Sahel, which is an area that sort of populations in conflict move freely across borders, humanitarian funding is already in short supply, and the displaced populations there lack access to health services, water, and sanitation. We've gone over, how that can really be problematic for people just washing their hands in order to prevent exposure. South Sudan, you have about 1.47 million IDPs and 2.2 million refugees. Again, food insecurity is a huge issue, poor health infrastructure. There's also a large UN peacekeeping mission in South Sudan, which means that there's a UN presence and staff rotations in South Sudan, which adds an additional vector for the disease to spread. The UN and troops contributing to that are really trying to take steps to limit potential for exposure, including a temporary freeze on staff travel, but that, again, limits services and things like that. So it's a much more complicated narrative than just stopping travel. Colombia, as of March 29th, there's 608 cases of COVID. There's 1.7 million Venezuelans in Colombia that are supposedly given the right to access healthcare, but many Venezuelans find that it's difficult to actually fulfill that and are still really heavily reliant on humanitarian agencies, particularly at the border. Greece has really been in the news because there's 40,000 asylum seekers and there was complete shutdown of the Greek asylum system. It really leaves those asylum seekers in a precarious position. The Syrian crisis, there's no confirmed cases in Idlib, but which is in northern Syria, but that's likely due to a lack of testing and not the reality. There has been reports of symptoms. And in general, in the communities that are surrounding Syria, like Lebanon and Jordan, there needs to be more done to prepare the camps that host the Syrian refugees. So, in the United States, we're not exempt from all of these sort of violations happening around the world. The US leads the world in confirmed coronavirus cases. Policies like the Migration Protection Protocols, which is also known as the Remain in Mexico program, has forced asylum seekers to be returned to northern Mexico. I think there's about 60,000 asylum seekers from Central America and North America, and then there's actually like an additional 15,000 Mexican asylum seekers who've also been returned. In general, these asylum seekers are in ill-equipped shelters and informal open-air encampments. A lot of these shelters are experiencing closures in the recent weeks because March 21st, the US closed the border completely. This actually empowers DHS to turn back asylum seekers without due process, which is a violation of US obligations under international law. And because of the border closure, humanitarian workers cannot bring critical supplies to Mexico. So these populations have been forced into Mexico. They're in sort of ill-equipped shelters, and now humanitarian aid cannot even reach them. So also related to the US environment, the public charge rule, which sort of restricts social service access for immigrants who want to eventually get a green card, permanent residency. Those new regulations went into effect on Monday, February 24th, but on March 15th, it was announced that these regulations would not be applied to testing, treatment, and prevention of COVID-19. It's almost too little, too late, because there was so much discussion of public charge and so many complications introduced into the immigration system because of public charge that people are still sort of afraid to seek care and treatment and do not know that they have the right to. It's a sort of a complicated paragraph written on a website that says, oh, this isn't going to apply to public charge, but the research hasn't really been disseminated and the statement hasn't been widely disseminated yet. There are organizations that are really trying to get the word out, immigrant serving organizations. So the protectingimmigrantfamilies.org has sort of fact sheets and things that can really help those who lack documentation and those who are unclear about, seeking healthcare. Sort of provides a little bit of an overview. So it's good to seek out those types of resources to inform communities that need them. In general, states and the rights of the displaced. So states should take specific actions to include migrants and refugees in the national prevention and response. I mean, this is the only way to include health for all persons. This needs to involve ensuring equal access to information, testing, and healthcare, regardless of migrant status. Importantly, firewalls that separate immigration enforcement activities from the ability of migrants and refugees to access healthcare and other essential services are needed. There is no reason that in the United States there should be immigration enforcement activities around hospitals or clinics. Portugal, I think, announced yesterday that they were giving migrants and asylum seekers full citizenship rights during the coronavirus outbreak. This is, important, and hopefully other states follow suit. This is the only way to protect the health of everybody. International support is really needed to help host countries step up services for both migrants and their local communities, because refugees have to be part of the state response. And so a lot of that response is reliant on international support. So specific steps should be taken to really ensure that support continues and to counter any anti-migrant hostility and xenophobia. Importantly, border controls and travel restrictions should not prevent people who are fleeing from war or persecution from accessing safety and protection. Some of this I've already mentioned, but really quickly, we have a responsibility to combat all forms of stigma and discrimination. We really need to shift this narrative surrounding the crisis from to the virus is the enemy, not the person who is infected. We need to adopt policies that increase access to child care, health care, and humane sanitary living conditions for all persons. We need to establish sanctuary sites, repeal travel bans, repeal restrictions on the provision of health care to immigrants. And we really should establish and enforce a quarantine bill of rights, because quarantine policies are often, at least in the United States, really up to the state level, and there's very limited protections within them. On a final note, I think that we have a responsibility to engage affected communities from the beginning in all response measures. It's the only way to build trust. We've learned this from past outbreaks, including Ebola. It's a little bit late in a lot of contexts, but it's still better late than never to start really engaging communities, particularly migrant and immigrant communities. And then you just really have to ensure access to free or affordable screening, testing, and care for all, including the most vulnerable individuals. And one last plug, a lot of people have been pushing to release populations from detention in the United States, and that's absolutely essential. There's 40,000 people who are seeking asylum held in detention in unsanitary conditions, and over 3,000 physicians have signed a letter asking ICE to release those populations for the sake of the pandemic and to improve the health of everybody. So with that, I will end.
Thank you so much, Goleen. That was a really helpful overview of kind of some of the global challenges and the way they're making themselves felt in different corners of the world. So thank you for that. Bruce, over to you now to talk about some of the reporting and media challenges in this space.
Well, thank you. And let me just say that I appreciate Ken and Goleen's presentations a lot, and in particular, Goleen, I'm in awe of the framework that you laid out for understanding this. It's really helpful. And I know I was taking lots of notes, and I hope others were too, because you're already changing my own thinking a little bit. It's really super helpful. So I want to start talking about media and the coronavirus crisis, but to start by saying I have a kind of general allergy for talking about the media, capital T, capital M. I don't think in general it's helpful, and I think in particular in this crisis, it's a way of mushing together an incredibly complex and multifaceted media ecosystem in which you have journalists and journalism and their professional role, their civil society role, in which you have social media, user-generated content, etc., in which you have the social media platforms themselves, in which you have state and non-state actors communicating directly through those. It's a very complex ecosystem, and I'm not even going to begin to try to describe it all. I want to focus in particular, just at least as a way of starting, on the journalism piece. And what I see are some of what Monette correctly called at the beginning, the tensions and challenges for the work of news gathering and the work of of journalism in general around the world right now. First of all, I should say that while this pandemic is new in its breadth and the way it touches everyone, there's a lot of history to the way that the role of news media, the role of journalists changes during disaster. I'm going to talk a little bit about that, changes that we have seen in natural disasters like the Boxing Day tsunami, in Hurricane Katrina, more recent hurricanes and earthquakes in Haiti and elsewhere, and also to talk a little bit about the way the interaction between journalists and the public is altered by these kinds of events, and then some of the challenges I see very specifically arising out of this crisis. So, first of all, when any kind of vast natural disaster happens, which is in one sense what this pandemic is, there's what you could describe as the traditional breaking news role of journalism. Reporters, both in democracies and authoritarian countries, are out there as frontline chroniclers with the traditional and crucial role of helping publics and states calibrate response, telling people what is going on in an accurate way so that as individuals and as societies, we can respond properly. And in a second phase, sometimes simultaneous, but often a second phase, the job of news media is in part to hold official response and communal response to account, to compare response with the known facts, to lay out lines of accountability for failure and abuses. And, we're seeing both of those traditional roles already in a quite profound way with remarkable reporting all over the world. The breaking news front, we've had all kinds of reports from Italy and from China, and it should be said, Chinese journalists resisting calls for official censorship to describe as best they can the outlines of the crisis. Here in the U.S., the daily fact check of what the president is saying, but also that frontline documentation coming from Elmhurst Hospital in Queens, coming from Louisiana, which is experiencing its own outbreak, and Detroit. We're getting some remarkable journalism. And of course, there's a third important job now that journalists have, which is to bear witness for those who are affected and who otherwise would not have a way to amplify their experiences or be recognized. All of that is what journalism does every day. It's what journalism does in disaster. But the stakes are raised. The stakes in the accuracy of frontline reporting are raised. The stakes in holding power to account are raised, and the stakes for both survivors and journalists in bearing witness to everyday experiences are raised. And we can talk more about each of those different kinds of roles. But along with that, what you see in disaster, and I'm hearing a lot about from a lot of both individual journalists and institutional newsrooms around the world, is that the role of journalism and journalism platforms changes. We are not only the independent chroniclers and bearers of witness. We also are turned to communicate outward official public health information that may be life-saving and that's crucial. We are turned to as the channels of official legal and political communication in times of pandemic. And you see the tension from that every day in the kind of strange press conferences coming from the White House, where you have, on the one hand, the sort of price of admission is listening to a president who says whatever's on his mind, accurate or not, and has been in denial up until recently, all that. And on the you sit with that long enough, you get to hear the real experts speak and figure out who's right. But the news organizations are also a channel back. We've seen in many past crises, for example, in Hurricane Katrina, citizens turning to trusted local newspapers and television stations to say, help me find my cousin. And we're getting a lot of that now. This is invisible. A lot of, if you're not working in the news media, you're not going to know this, but in small communities and large around the world, journalists are being tweeted at and sent emails and being called saying, I need to know what's going to happen to my store in my neighborhood. I need to know where I can go for help. And this public communication role is a two-way street that becomes really important and robust, being a channel back to government and channel to power. That's a change. And then finally, we also have in the new kind of social media world, the role of journalists and journalism as trusted mediators and trusted interlocutors, or mistrusted communicators and mistrusted interlocutors. There's the way in which this plays in a polarized world that I think is really challenging. And all of that, each of these roles, you can see now in a big way. You know, on the accountability front, you have had, as I think Ken and Goleen both mentioned, you've had, you know, China trying to sanction reporters, international reporters. Egypt threw out a wonderful reporter for The Guardian, Ruth Michelson, who has been in Egypt for years, who insisted on publishing the accurate numbers and accurate estimates for coronavirus cases in Egypt as the government was trying to avoid it. So you've got those kind of tensions that are traditional. You also have new tensions that are specific to this pandemic. There are tensions around the safety of journalists. How do we go out and practice reporting that's essential amid social distancing, where you're worried not just about the journalist's role in their own safety and that of their families, but journalists who don't want to be agents of further spreading the virus. In the background, we at the Art Center have been having a lot of conversations with folks in which we're sharing techniques that people are making up as they go along. Always bring what's called a shotgun mic, one of those microphones on a long boom, so you can interview people from 6 feet away. Are there ways of using distanced reporting, using Zoom and other things to get what you could get? All of this sort of stuff is really hard, along with a huge challenge to free expression in this pandemic, which is simply burnout. Journalists who are dealing with the same unremitting stress that all of us are as citizens, yet also working from home within a 24-hour news cycle amid a constant barrage of information and the constant risk and reality of colleagues becoming sick and needing to be filled in for. There's a huge set of challenges which would be sort of operational, but become full-fledged press freedom challenges as a consequence of COVID-19. And you've seen some governments around the world, though I would say not the US, begin to recognize this. For example, in Ireland, part of the Irish national response has been to directly subsidize local and community news organizations by ensuring their distribution to every house of any person who is shut in, essentially making sure that there's still kind of a customer base. We haven't gone far enough in figuring out what kinds of support local journalism needs, but we are in the US in particular danger right now because local media has been in crisis for several years, and this is true around the world too, in which advertising bases have the advertising base has dried up. Newsrooms have been teetering on the edge. They're literally collapsing just at the point when accurate community-based information is most important. So the economic side, the press freedom, is colliding with this virus in a way that I think is profoundly threatening to the public interest, and we're only just beginning to grapple with that. The most important in communities that are not media saturated, that rely on one or two local public radio or traditional legacy news outlets, where the wave of coronavirus deaths and the wave of diagnoses is going to hit later than in the media capitals of New York or San Francisco or London. By the time towns in Missouri or Alabama or communities in Bangladesh away from the media capitals, by the time they are saturated with coronavirus, there are so few reporters to tell the world or to bear witness what's going on in those communities or to communicate information downward. So we've got a kind of economically driven press freedom crisis colliding with the massive public need in this in this pandemic. Secondly, as Ken said, but I want to amplify, you have authoritarian regimes around the world using this pandemic as an excuse to clamp down on inconvenient journalists and journalists who are operating independently and refusing to simply only be channels for official communication. Again, we can see that in China. We are seeing that in India, where journalists now are being required to publish all official statements and being sanctioned and indeed are subject to prosecution for putting out other kinds of information or not doing what the government wants on that, or the case of Thailand that I think Ken brought up. So we're seeing authoritarians use this as an excuse to clamp down. We're also seeing authoritarians amplify what they already have been doing for the last several years, which is using social media and using the ethical boundaries of traditional media to pump out continual misinformation that enhances their power. We're seeing that in Russia, where the state has restricted and is simply, I think, not putting out a lot of the statistics that we know are out there, or simply not doing the tests that are needed, so there's not information. We're seeing it in the United States, where President Trump, on the one hand, allows the CDC folks to speak, but on the other hand, persistently puts out misinformation, which is not just misinformation about the virus, but is part of a sustained campaign to advance authoritarian and scapegoating-based, resentment-based politics. So the mobilization of resentment, which has been such a big problem for democracy worldwide, is now becoming tied up with resentment based in public health misinformation that goes to the kind of heart of people's rights to health, people's rights to free access to information, and the rights of journalists. I think it's very important. We're also seeing an ethical tension between responsible reporting and media outlets, including some very powerful ones, like Fox here in the U.S., News Corp in Europe, which again are playing this balancing act between doing news in a traditional way and putting out public information and accelerating scapegoating politics. That's a complicated situation. And you're seeing governments call for wartime-like censorship in an environment in which I think that will destroy public trust in the independence of media. I think we need, as we're trying to understand the tensions in getting appropriate information and appropriate public messaging, public health messaging out there, we do need to understand that the public's trust in media and its independence is going to be a crucial element in getting public cooperation. I think those nations which think this is a moment, or even those health professionals who think that this is a moment to kind of control messaging to the official public health messaging, are missing the point. The public wants to know that there's an independent media out there, and I think that's a crucial part of the right's perspective on this. So, in other words, I think what we have is a combination of professional and ethical challenges that take on important press freedom elements, given the risks to journalism in general right now. We're seeing authoritarian responses that are manipulating the crisis to further suppress independent journalism that's already under attack. And we're seeing a need for innovation in the relationship between responsible public health communicators and independent news media in a social media environment. And I'll shut up there, go to conversation.
Thank you so much, Bruce. I mean, you've all given us a huge amount to think about. Lizzie, are you going to help guide us through the logistics of the conversation? I know that from my classes now, I look for the little blue hand. But if you want to tag team it with me to kind of identify people, I'd appreciate that. And we have about 20-25 minutes left for a discussion. So let's see those blue hands go up, and if need be, I'll take a cluster of questions, for our speakers at a time. And I would just ask, when you ask your question, could you put on your videos so our speakers can see who you are, and just identify who you are, and we'll take things from there. So any blue hands? You seeing any, Lizzie?
Lizzie, maybe you should walk through again how people can raise the blue hands, because for anyone who's new to Zoom, it's not always completely obvious.
Yep. So thank you. Just a reminder to everyone, in order to raise your hand, just hover your mouse over the screen, and you should see on the bottom panel participants icon. If you click on that, the box on the right should pop up, and there on the bottom left is a little hand signal that's blue. If you click on that, that indicates to us that your hand is raised, and then we can call on you. And Monette, we do have a hand raised. Joanne.
I do. I see Joanne. Absolutely, Joanne. You'll need to unmute. Yeah.
Hi, everyone. Thanks for all that. Just a brief comment. The point that has been made about the importance of releasing prisoners and detainees is really crucial, but what we're already seeing is that this can also be done in a very counterproductive way. If people who are positive are released into the community without any help to be sure that they can self-quarantine or that they can be safe themselves and not add challenges of the community, it's going to be a counterproductive move. So we need to understand the release of detainees as something that has two pieces, the release and then the support to be sure that they can thrive in the community and not infect others.
Thank you, Joanne. So I'll leave that as a comment and a reflection, and perhaps just store that if you have any thoughts, speakers. We have a second blue hand up from Jenna. Jenna, are you there?
Yes, I'm here. I also typed this into the chat, so I apologize for the overlap. I apologize in advance. I had to step away for a moment to take care of my puppy in the middle of the presentation, so I apologize if this has been covered. But I'd really appreciate hearing all of your thoughts and insights on how the current COVID-19 pandemic is affecting the human rights of people, specifically in the US, who have active substance use. And so specifically in that realm, the provision of harm reduction services like methadone provision, needle exchange, and then as well shelter services, which are at normal times few and far between.
Thank you, Jenna. You did not miss that, and when you stepped away to look after your puppy, that is something that we haven't addressed, so I'll ask our panelists to think a little bit about that. And in the meantime, also ask others to put up their blue hands so that we can keep the questions coming. But over to you. Let's start with Goleen. Shall we start with you and then go to Ken? And then Bruce, if you have anything to add.
Sure, and others feel free to chime in, particularly on the substance abuse services, because that's not an area that I particularly know a lot about, but I agree that their harm reduction needs to be a strategy that's employed, particularly for those populations. Also with the releasing the detainees, absolutely, you can't just blindly release detainees without sort of appropriate care provision or a place for them to go and things like that. So it has to sort of be a comprehensive community-based approach and thought through. I think people are just frustrated that at least in the US context, ICE being resistant. I mean, they even had gone to court to argue against simple hygienic measures for children in detention. So I think it's sort of a dire situation with like really poor access to sanitation and hygiene. And so people want to quickly sort of get those populations released, but it's important to really think about sort of how to do that safely and to ensure their safety and public safety as a whole.
Thanks, Goleen. Ken or Bruce, do you have anything you wanted to add to that? Ken, I see you've unmuted.
Yeah, I know. I just, I don't think we know empirically what's happening to harm reduction services. It's a good question. And, you know, we're aware that, you know, many hospitals are deferring what they call non-essential treatment. And we just don't know how this is being classified, you know, and so I think it's something that's worth looking at. It certainly is an area of caution.
You know, I would say on this, first of all, I mean, and this is in response actually to both Joanne's comment and this question. Thinking about who is on this call, actually, I want to say to you that if you are engaged with marginalized populations, whether it is substance abusers or prisoners who are released or migrants, reach out to reporters who are covering these beats. We need you as sources. It is not by magic that news organizations find these stories and are able to surface them, right? It's by relationships between journalists and frontline providers. So, you know, I'm actually sitting here scribbling down story ideas from all of your questions, which I am going to like fan out to reporters in my own social network. But journalists are looking for ways of engaging. We don't know who these populations are or how to reach them. So you are in a very powerful position right now to be a bridge. And it can just be by saying, you know, write to some local reporter in a town or to whoever's covering it for NPR or the New York Times or the BBC and saying, you know, look at homeless shelters. Hey, look at this particular aspect of migrants. It's really crucial. We need you to be sources, whistleblowers, guides right now. It's the only way we're going to be able to surface it.
Thanks, Bruce. Call to action to all of you. Joanne, I would like to ask you perhaps to comment on that question specifically, as I know it's an area you cover closely.
Thanks very much, Monette. Yeah, I think we do know a lot about the challenges that are happening to harm reduction services, and thanks, Jenna, for the question. We know for sure that some of the methadone patients who were forced into quarantine in China were essentially forced into withdrawal because they couldn't get their methadone. It's a funny thing. We've advocated for so long in this country for methadone to be more integrated in primary health care. Methadone is a completely standalone system. It's not even in any sense in the health system. And that's a bit of a silver lining right now because people can go to their methadone clinics without interfering with the health services that are so important in the secondary and tertiary facilities. But that's still not to say that there aren't challenges. And I do fear greatly for the people who are getting buprenorphine from their primary care physicians in this country. I think around the world, what we're advocating for is that people have take-home doses, which is not always the case in methadone programs where people are forced to line up every day. And now with isolation and quarantine may not be able to do that. Same with needle exchanges. The one-to-one needle exchange has to go out the window in this situation. People have to be able to walk away with the equipment that they need. So these things are active advocacy areas for us in public health in many parts of the world. And thanks for the question.
Thanks, Joanne. So I see both through the chat and through the blue hands, a couple more questions. One.
Hello, thank you so much. My question has kind of been answered in a way, but if anyone else has any other thoughts, it's just so many potential action points have been presented, and so I'm just curious to know from the panelists any, in addition to what was mentioned by Mr. Shapiro, just ways in which we can utilize our ability skills networks to continue to shed light and perhaps put forth some actionable advocacy. So just kind of next steps, action items. Thank you.
Thank you, Alexis. I'm tempted to take our second question at the same time. Joanne.
Hi, sorry, I'm trying to audio issues here, so I won't be turning on my video. But my question is, so you talked a lot about the roles of the news media and reporting accurate numbers and the journalism role in finding reporting numbers on public health issues is the specific mandate, right, of public health institutions. Ideally, there definitely should be collaboration between the two. I was just wondering your thoughts about the power struggle regarding the communication of public health data, especially in crises, and the information vacuum that journalists may leave in the case of stable countries, or the perhaps unintended seed of mistrust, perhaps planted in institutions after the emergency reporting is over.
Thank you. Did you get enough of that?
I think I got enough of it, though, Joanne.
Okay.
You broke up a bit. So if I answer what I think you asked, and it's a total delusion, forgive me. So I think in terms of the relationship between information sources and journalists, in my experience, good communication happens when there is ongoing trusted relationships, even between people on opposite sides of the wire, journalists and government officials, whatever. And a lot hinges on relationships that are built up prior to crisis. So, it may be too late for that in a lot of nations and in a lot of states, but it is worth thinking about a kind of before and during approach in general to managing pandemics. And it's still not too late. That is, the pressure of the news cycle, the pressure of deadlines can make people seem at odds. I think there needs to be a commitment to sort of off-the-record conversations between news professionals and public health professionals that are not always going to be quoted, but are like, what do you need, so that we all understand what each of us sees as our role and responsibility right now. One thing that health professionals could be doing, for example, is convening conversations like this with a few journalists to say, what does each side in this equation need in order to do our job for the next couple of weeks? Often there's a deep mistrust and misunderstanding, even in healthy democracies, between institutional players and reporters who see themselves as, at odds. So, and also between clinicians who often don't trust media, because even the job of good journalism is to tell public stories, and the work of clinicians often involves confidentiality and, helping people preserve their privacy if they so choose to. So there are tensions there. The more we can be talking in the background about, okay, we've got another couple months of this. What should public health officials know about what journalists need? What should journalists know about the public health world? We'll do much better, and that in turn will help to make stronger stories that ride over the heads of whatever bullshit political leaders are trying to kind of put out there. I guess I would answer it that way. There may be parts of your question that I didn't understand because the line was breaking up, but I'd answer it that way.
Bruce, can I ask you a follow-up sort of related to that question?
Yes.
So I've been thinking lately about the fact that sort of the New York Times has the most up-to-date case data, and they release the raw data files for public health researchers to sort of analyze. And then I think about sort of the structure of that. So like the public health, like epidemiologists, shouldn't that data be coming from epidemiologists and then going to it's almost reversed. And so a lot of people have sort of been like, so why is this how it should be? Is this indicative of a sort of problem in the system, or why is it set up this way?
Well, I'd say it's indicative of a kind of a reality in news media that civilians aren't aware of, which is that data, innovative and agile grabbing and use of data has become central to news reporting. And a place like the New York Times has whole teams of people who become devoted to statistics, where to find it, how to organize it, and so on. So and because we are operating outside of academic ethics constraints and outside of academic bureaucratic constraints, there is sometimes an agility to journalists' ability to harness big data and imagine visualization of it, imagine expression of it that's very helpful to the public. Okay. Right now, big data is central to investigative reporting all over the world, and not only on public health, right? This is a big change in journalism. So I don't see it as either good or bad. I see it as a fact. But I think creating perhaps some more opportunities for public health researchers working on the pandemic and data journalists to communicate about what one another is doing, what their needs are, what possible collaborations are. I think that's the way to think about it. Not as sort of a power struggle, but as people as two camps with different research capacities, different kind of agendas in terms of how they address need, and slightly different methodologies, but both working with big data. So again, I think communication, and I'm kind of getting ideas as we're speaking. Maybe chapter 2 of this talk needs to be that, but I think that's going to be crucial. Journalism now is very devoted to data, and by the way, that goes down to the local level. Here in the U.S., many states now have local nonprofit news sites that rely heavily on data. Here where I live in New Haven, Connecticut, there's something called the Connecticut Health Investigative Team, which provides terrific stories on public health matters in partnership with Legacy Media and on their own website. They're like 3 people and a bunch of students, but they really know how to do this. And there's similar nonprofits in many parts of the world, loosely organized into something called the Global Investigative Journalism Network. So we need to know what one another is doing. That's how I'd answer it, Goleen.
So, folks, I'm conscious of the
Sure. One quickie on this, 2 quick points. And this is really about just the role of, of public health experts, which you all are. A lot of, it's very easy for us to be kind of, to say this is what human rights law requires, this is what you should do, this is the right thing to do. In times of public fear, those prescriptive arguments tend not to work. And you have to make pragmatic arguments to accompany the prescriptive ones. And you all are in a good position to do that because, using the kinds of data that Bruce mentioned, there's plenty of data, but there's also just your experience to know, what is an effective public health strategy and what isn't. And that bringing in that pragmatic dimension and telling people that if you follow this route, you're going to make it worse for yourself. You may not care about those marginalized people, but think about yourself. And, you may not like to make those self-interested arguments, but they're actually critical in times of public fear. So I just wanted to sort of, as you're talking about your role, this is something you all can do because you've got an expertise that can be deployed. The second point I wanted to make is that I've noticed that at the global level, the big public health institutions do not criticize each other. So, whether it's WHO or Gavi or the Gates Foundation or the Wellcome Trust or what have you, they all work together and they don't criticize each other. And indeed, they don't criticize governments for the most part either because they've all adopted the view that they have to work with governments, and if they're all afraid of a kind of a revenge mentality that tends to dominate in places like Beijing. So there is a need for informed public critics who are not connected to those institutions, but have the relative safety of being either a student or a faculty member at a university to talk about these things. And the journalists are there. I mean, they will take it. They just need informed perspectives.
Yeah, that's right. And I would also add that this is also a time to throw together op-eds and Facebook posts and other things that can help illuminate the public discussion by providing an independent voice and an independent expert perspective. You know, there are lots of ways of getting there, and we can talk about that, but I think what Ken says is absolutely critical. You guys have the expertise.
So that's definitely a call to action, and I don't want to lose sight of Alexis's comment and question, which is, of the list of advocacy follow-ups, what should we really be focusing on? And so you've started to think through that with us. So I wanted to just put that to you as possibly the last question, and I wanted to tack one on myself using the prerogative of chair, which is, where are the opportunities in this crisis to perhaps recraft the narrative around public health and human rights? And all of you alluded to that in some way in your presentations, whether it was, you know, the Portuguese, you know, legalization of undocumented migrants in a bid to have them access care, whether it's that fundamental understanding that our health is now all interconnected in some way, whether it's the need, as Bruce said, to think in a more creative way about reporting, because the usual sort of ability to go into the field and interview face-to-face is not quite as simple as it used to be. I would like to add that to Alexis's question. So what are the follow-up items we should really highlight? And finally, what are the opportunities to perhaps think more opportunistically about something good coming out of this crisis for human rights and health? So, Ken, perhaps I could start with you.
I mean, you know, it's obviously there's so many areas that could be pursued, you know, and I mean, just as, you know, the Viktor Orbáns of the world view a crisis as an opportunity to seize power, we also have to think about a crisis as an opportunity to get people to rethink practices that may have been, you know, misguided or nefarious or what have you. I mean, just, you know, the obvious one is the over-incarceration problem, where we have momentum already. There already is, you know, kind of a growing recognition that it's just, you know, super expensive and doesn't really solve rehabilitation. And I mean, you know, so even the, you know, say mainstream Republicans are now rethinking this. I think that, you know, this pandemic gives us an opportunity to fast track that, you know, to fast track discussion about why do we have immigration detention? You know, it's not a crime to be in the country, particularly if you come as an asylum seeker. You know, why are people being detained when we know that there are other mechanisms that get people to court on their assigned dates, you know, completely reliably, and that you don't need to be detaining people. So, I mean, I think bringing up things like that, there are many, many examples, but thinking in those terms, you know, what are the practices right now? I mean, you know, Joanne was talking in terms of, you know, needle exchange. I mean, this, if it's aggravating the public health problem to make people, you know, trade in one needle for one needle, let's, you know, use the public health arguments now to get past that. And once people get used to doing it in a more sane way, they'll stick with it. So I think we just have to think through, you know, a number of issues of concern and figure out, you know, not only what is a sensible public health approach, but are there ways in which current consciousness about public health threats can get a different answer than might have been the case otherwise. And a temporary answer today can turn into a permanent answer very easily.
Thank you, Ken. Goleen, very briefly, sorry.
Sure, no problem. First, to sort of give a real action point to Alexis's question, Public Health Awakened and the Spirit of 1848, they've created a resource. It's really through a Google Doc, and I can sort of share the link for that. Depending on which communities you're really interested in, amongst all these communities that we recognize are sort of marginalized or vulnerable, they've compiled resources and are continuing to gather resources of like fact sheets for those communities, approaches, really sort of a right-centered approach to making sure that those communities get care. So you can both contribute resources or connect with organizations that are trying to do outreach and things like that. And that's something that you can do very easily as a public health person from your living room that can offer sort of or have a real impact for those different communities. I mean, for immigrants in particular, there was a huge need for for COVID information in a variety of languages. And so there's been a rapid effort to produce that type of information. There's a huge need to figure out how to encourage hand washing in refugee camps. And there's some of that effort is around song right now and soap making efforts and things like that. So there's ways to contribute both ideas and actual resources in that space. And so I can share that information. To answer a little bit of Monette's question, I think that this pandemic really shows us that our health is only as good as our neighbors, and that the right to healthcare access for all is actually what's going to be the upstream public health approach. And so we've been saying for years, you know, healthcare for all, universal basic income, and making these types of arguments. But until you have sort of something that really levels the playing field and shows you why that's important, like what we're going through right now, and the fact that we won't fully sort of recover from this until we enable access to testing for all these different populations and treatment. I think that that's going to change the game for public health moving forward, and I think that that enables us to have, unfortunately, a more robust argument for a lot of the work that we do.
Fabulous. Thanks, Goleen. And Bruce.
So I think one of the things about times of fear and uncertainty is that people's minds, all of our minds, are open to new ways of framing a fearful time. Authoritarians know this. That's why authoritarians can thrive in disasters and pandemics. They know people are afraid and are really there for messaging. I think there's a concrete individual action point that also is a group action point, which is to make sure that this is systematically being framed as a human rights crisis. Simply use the word, this is a human rights issue. Use that every time you talk to a reporter, you talk to a colleague, you talk to a friend. Keep putting it out there, and especially in social media posts. There's an opportunity to kind of inject this framework, this language, into the public debate. Think about the way Yale historian Timothy Snyder's little Facebook post on tyranny took off after the election of President Trump and the Brexit referendum in the UK. You'd never know what's going to grab, and the more we're using that language, the more people will adopt it in a, I hesitate to use the word viral way. Related to that, I would also think about continuing this conversation, this framing, with perhaps a social media group, a Facebook group that is coronavirus and human rights, and in which things like the Portuguese example and other bits of information are all we're just sharing stuff as we find it, so that we're strengthening our own ability to make the human rights argument at a time of fear and a time of uncertainty.
Thank you so much what a wonderful panel. I mean, you've not only given us a really thoughtful global overview of some of the main challenges, but your comments and your reflections have given us hope and a lot of things that we can be doing in our own realms to really address this. So really from the bottom of my heart, from behalf of all my colleagues and students, thank you so much for making the time to be with us today. I have one last request. In the spirit of using social media, we'd love everyone to put on their videos so that we can get a little screenshot of the fact that we are all gathered in this virtual way to talk about human rights and the COVID response. So if you could do that, and oh, it's so nice to see you all, I have to say. It's lovely. Okay, so who's taking the screenshot? Rocio, did you get it? Yes? 3, 2, 1, go. All righty. Thank you all so much, everyone. Take care, be healthy, and see you soon.
Bye-bye. Thanks.
Bye.
Bye-bye.
Thank you.
Bye-bye.
Thank you all.